Hello everyone friends, Mr. Dent Clinic, and now I want to tell you a little about the process that is happening here. Here we see a scanned tooth, the one that had to be prepared for a ceramic crown. Previously we made it depulpated due to a very deep carious cavity. I have all these photos. I may post this clinical case later if it is cool. Here we have this tooth, which we have prepared for a ceramic crown. The preparation here was quite voluminous because since the teeth are depulpated, I no longer see the point of preserving the hard tissue of the tooth in that volume to make some kind of minim-invasive preparation. Here I have already prepared a table for myself. As usual, I have a photo of the tooth that I will need to recreate on my table. Today we are working with this fourth tooth and we will try to draw it. There is also a palette in which a little ceramics are diluted, a little paint, glaze, which we will apply later. There is a special holder to hold the crown. Sometimes I use a liquid trigger, but here I just put it on a tablet. And a little brush with different thickness of the working part in order to bring the glaze somewhere, apply ceramic somewhere if necessary, and then paint some fissures with thin brushes. I also use a file to distribute the paint inside the fissures, and while we were